Welcome back to Open Line, talking about open enrollment for Medicare. We have with us Lisa Wright from BlueCross Blue Shield. This is the time, December 7th.
December 7th, we're almost there.
See, I knew, because I've learned. It's December 7th. That is the deadline to enroll. And so this is an important time. We have several calls. Let's go to the phones. Let's go to Richard. Hello, Richard.
Hello.
Hi, go right ahead.
Oh, okay. I got a question. I'm enrolled in a supplemental Medicare F plan. Would there be any advantage for me to enroll into an Advantage plan?
So that's a really good question. Thank you for asking that. I do get that quite often. So the supplement that you have in place, Supplement F as in Frank, that plan, pretty much you lay down your Medicare card and it picks up second to Medicare. So it's going to pick up your out-of-pocket expense. If you move to an Advantage plan, you can save those premium dollars, but you're going to have to face co-payments and co-insurance percentages out of your pocket instead of the monthly premium. So before you move, one of the things you should do is list the way that you use your benefits the most. And when you're exploring your plans, let's say you have a $10 office visit copay or a $35 office visit copay with that Medicare Advantage plan, add up what it would cost based on how you use your benefits today and know whether that would be a benefit to you to move to an Advantage plan. The Advantage plans can give you some extras that supplement doesn't offer, and they can include your drug coverage all in one. So that gives you some convenience. But do the math first and see if it's going to work out for you based on how you use your services.
All right. Now, Richard, does that answer your question? Okay, good. All right, thanks, Richard. Let's go to Taylor. Hello, Taylor.
Good evening, Ben, to you and Miss Wright, and I will start out with a happy Thanksgiving to both of you.
Happy Thanksgiving. Thanks.
My question is, I know somewhat the difference between the two HMO and PPO, knowing that the HMO is more restrictive than the other. But tell me some of the other differences, if there is any, other than the fact that one has a more restrictive network than the other, if you will, please.
Absolutely. So that's a great question. An HMO, you are exactly right, has a more restrictive or a smaller network. So you would be limited to fewer doctors or hospitals that are in network. An HMO, Health Maintenance Organization, means that if you go outside of that network, typically you're not covered. So not only is it more restrictive, but you have to stay within that network unless it's an emergency or urgently needed care or out-of-area dialysis. So those things are going to be taken care of for you outside of that network. The PPO, Preferred Provider Organization, typically has more doctors included, so it gives you a larger network, but a PPO also gives you out-of-network benefits, meaning that you can go outside of the network, but it's just going to cost you more. So it gives you not only a larger network, but also out-of-network benefits. Either way you go, you still have coverage for those emergencies, the urgently needed care, and lastly, that out-of-area dialysis, which is life-sustaining for many individuals.
All right. Do you have another question, Taylor?
No, I thought maybe there's even more differences than that, but that explains it, unless there's more to it that she didn't get to. Thank you very much.
Thank you.
And that's pretty much it.
That is it. And a lot of times people call it the HMO or the PPO, and they're talking about different plan designs, but the actual network, that piece is what drives the differences. But each plan design can be different as far as what you're going to pay at the doctor or the hospital.
When we're talking about extras offered, what do people need to know in that world?
So when we talk about Medicare and a supplement, Medicare pays medically necessary services for hospital stay, a doctor's office visit, that outpatient surgery that you might need. Medicare does not cover some of the things that we also partake in for that quality of life, such as dental, vision, hearing aid coverage. It doesn't provide that. So when you're looking at coverage for those services, and when I say dental, I'm talking cleanings, crowns, fillings. Medicare doesn't cover that. The Advantage plans may offer you some of that additional coverage. Vision, Medicare covers diseases of the eye, so glaucoma, cataracts, macular degeneration. Medicare and a supplement's going to take care of that. But the Advantage plans can actually include additional benefits to take care of the reason I wear glasses, and that's because as I get older, my vision is changing, so every year I go and have that prescription checked. An Advantage plan might cover that routine, as well as some eyewear. And then Medicare does not cover hearing aid benefits or hearing aid coverage, and so an individual looking at an Advantage plan might consider the hearing aid benefit that could be included.
I mean, that's pretty important. As you get older, you would want all of that. You would want dental, you would want vision, but that's not part of normal Medicare.
It's not. And so, the main reason that you have Medicare and a supplement or an Advantage plan by itself, either way you go, it's meant to protect that financial risk of a, as Reverend Fuzz talked about earlier, that financial risk of a huge expense. But the extras that we need, the Advantage plans can include those.
Now, you've been going to all of these meetings. We'll put those up in the next segment, all the meetings once again. But you're also doing other stuff. There are other ways that people can find out. They can certainly go to your website, but you've been doing stuff on Facebook.
We have, and actually...
A lot of people are on Facebook, by the way.
Actually, we have been on Facebook. Oh.
And we'll put those up in a moment, but I want to talk about the Facebook stuff. So what are you doing there, and how do people find what you're doing?
Sure. So our Facebook page is BCBST-Medicare. So if you want to go to our Facebook page, BCBST, that stands for Blue Cross Blue Shield Tennessee, -Medicare. And when you go there and click on videos, you can see the Facebook Live events we've done this whole year. So it's kind of an educational type series where we're talking about some of the things we've talked about tonight. My June event, for example, I talked about someone who's actively at work and what it means to them about choosing a Medicare option or staying on the active employer plan, much like I think it was Miss Pat asked us earlier.
Those Facebook Lives, they're great because people can interact, right? I mean, do you see that? And people ask like questions as you're doing it and you can respond directly to them.
So I have found that while they're watching, they're actually engaging with me after the event.
Right.
So they're watching the event, we can see those eyes knowing that you're online and participating in that way, but it seems to be they're attending the video more to learn what I have to say, and then on the back side they're asking us questions later. We've had some interesting conversations.
Let's go to Bob. Hello, Bob.
Oh, hello. Happy holidays and all that sort of stuff. I notice a lot of the credit corporations, even for the Medicaid, Medicare, and stuff like that, have been hacked. I've got a letter from AT&T, and a lot of people that I've talked to have closed out their bank account, but that's not good because they won't get their federal checks and stuff. They should go to the credit and report and get a routing number and a credit report number and close the credit account for 90 days or something.
So, all right, thank you, Bob. I think he's saying security issues.
Yeah.
A lot of people, a lot of companies are getting hacked, a lot of private information in these companies. That's a big concern for people. And he's saying people are shutting down their bank accounts, and I hate to hear that, but people concerned about that. What do you say?
So we have, obviously, as you might know, we have very strict security measures that we go through at our corporation. And so that includes not just protecting your premium payments, the financial information for those that automatically pay through a bank draft, for example, but also securing personal health information. So we have strict guidelines we have to go through from the association and through the different legislation where we are required to protect your protected health information, your PHI we call it, much like a doctor's office.
And this time of year you want people to know what about prescriptions?
Oh, so the holiday tomorrow, well actually 2 days from now, Thursday is Thanksgiving. I guess I'm getting anxious. Thursday is Thanksgiving, and so we know that you're going to have a lot of company coming into the home, and we ask that you consider a couple of things. You know, we've watched a lot of news reports actually on the opioid crisis and how folks get addicted to prescription drugs, and so we ask that maybe you consider the option of putting your prescription drugs up for the holiday, putting them in a secure place while family is there visiting. You don't want them to get in the wrong hands. You can purchase a lockbox at your local pharmacy to place them in a secure place while you have company in over the holidays. And if you have unused medication, visit your local police department. I know Metro Police has several of the Count It, Lock It, Drop It, where you can actually put those prescription drugs in a secure place that you're no longer taking and keep them out of our water systems.
Oh, that's great. All right, we're going to take a break. We'll come back, wrap everything up. Be back right after this.